All right, we are here with our next couple of guests. With me right now is Ashley.curri and Debbie.conley from Excellus Blue Cross Blue Shield. They are both Medicare sales consultants. Ashley has been with the company for 5 years and Debbie has been with the company for 30 years, and they help people navigate Medicare. Welcome, ladies, and thank you for joining me.
Thank you for having us.
Yes.
I'm going to go ahead and ask you guys a few questions if that's okay.
Sounds good.
Go for it.
First, can you guys tell me a little bit about Blue Cross Blue Shield?
Sure, I'll take that one. Since I'm pretty excited for Excellus, it's a great company, a great culture. We actually service 31 counties in upstate New York. We also service 1.5 million members. We've grown to 5,000 employees over this time. And the thing that I find that I'm really proud of is the fact that we remain local this whole time. So Ashley and I, we are the sales reps for the Utica region, which means that we sit in Utica, but we also cover 11 counties. So you might see us in Oneida, Herkimer, Madison County, up to Lewis County, and down to Binghamton, and a few in between. But the other thing I wanted to let people know today is a lot of times Excellus is synonymous with our commercial business because we do cover a lot of groups. But what Ashley and I do is we sell Medicare for individuals. And what we find is it's very confusing. So a big role that we play is educating them on what their original Medicare covers and when they go about applying and all that.
That's great.
That's my little synopsis.
So when is someone eligible for Medicare and when can they join?
So I'll take that one. So you could be eligible for Medicare in a few different ways. The first is obvious, right? You turn 65, you're going to be eligible for Medicare. But also if you have end-stage renal disease, that might qualify you as well. Or if you've been collecting Social Security disability for at least 24 months, you might be eligible to receive Medicare. When can somebody join though? Because that's kind of the big pending question. So for people turning 65, what you're going to want to do is contact Medicare about 3 months before your birth month. So that's going to be whether you're retiring or not. So if you're still working though, you might actually have an option to waive picking up your Part B. Now this is going to be based on your group size. So if you're going to be actively working and you're employed with a group of over 20 employees, you might have the option of waiving picking up that Part B. If you're working for a group and it's a smaller group under 20 employees, then you will have to pick up that Part B. And it's important to do so, so you don't get a penalty assigned to you. If you're thinking about whether or not you qualify or you can waive picking up that Part B, I always recommend checking with Social Security first, just to confirm that, because I don't want you to get a penalty later down the road. So lastly, some people might be under 65, right? And they might be eligible for Medicare. So if you've been collecting Social Security disability, like I mentioned, or at least those 24 months, you're not going to have to worry about contacting Social Security because they're going to actually contact you to enroll. So how do you enroll then? You do have 3 options to pick up your Medicare. You can do a paper application and send it in by mail. You can apply online, or you can actually call Social Security directly to enroll over the phone.
Well, that's a great information. So what are the parts of Medicare and what are some different enrollment options that people have?
So there are actually 2 parts to your original Medicare. You have your Part A and your Part B. So let's talk about the differences really quick. Your Part A is your hospital coverage. So that's going to include your inpatient hospital stays, your skilled nursing facilities, or your home care. Your Part B is actually your medical coverage. So this might include like your doctor's visits or some other outpatient medical services you might have done. So most individuals, after they hear all this, ask me, well, how much then does your Part A and Part B cost you? Your Part A premium. It's actually a free premium for most individuals. Because why? You've been contributing into Social Security almost your entire life. So as long as you have worked for 10 years and have contributed for 40 quarters, your Part A is actually going to be free to you at no cost. Your Part B, however, does come at a monthly premium. So the average monthly premium, and this figure is for 2020, is $144.60. Now this figure does change each year, but this is the most current dollar amount. So what happens once you enroll in Medicare Part A and Part B? You actually do have 2 additional coverage options that you can elect. The first is actually a Medicare supplement plan, which works in conjunction with your original Medicare. So in this scenario, Medicare is going to be your primary insurance and your Medicare supplement is going to be your secondary. If you elect this option of coverage, it's important to remember that you also have to choose separate prescription drug coverage to carry with that Medicare supplement plan. Now, your second option is actually one of our more popular options. It is the Medicare Advantage plan. So a Medicare Advantage plan will actually replace your original Medicare. Now, this coverage is going to cover everything that your original Medicare covers, plus you're going to get some additional benefits. So what do I mean by this? This might include dental coverage, vision, hearing, a gym membership like at the Parkway Community Center, right? As well as having your prescription drug coverage built into most policies. You just want to make sure if you choose a Medicare Advantage plan, you do have that drug coverage. What's nice about the Medicare Advantage plans, though, is that it's kind of one card for all services. So you're not going to have to carry around 3 cards with you where you go. It's important for people to remember when you're choosing between both of these options that not every person is going to be the same. So that's what me and Deb are here for, though. We're here to help you kind of filter through and navigate these options and make the best decision based on your medical needs, as well as one that will fit into your budget. And that's what we're here to do. We're here to help you guys get through and navigate those Medicare options.
So this is a lot of information. So
Yeah.
What are some things that people should look for when they're choosing a health plan?
Well, there's 3 things that come to mind to me. And the very first one would be network. So most people don't want to change their primary care doctor, their specialist. Maybe they're currently receiving services and they want the continuity of care. So you want to make sure that your doctor, your primary care, and your specialists are in the network of that health plan. In addition, you want to make sure that your prescriptions are going to be covered and understand what those costs will be to you when you move to that plan. And how you determine that is through their prescription formulary. And each plan tends to be different. So you want to make sure that you keep a list of your prescriptions, and when you meet with somebody, you let them know what you're taking. The third thing I think that is really important is a plan star rating. So Center for Medicare Services monitors the health plans, and what they do is they do a survey every year for the providers and the members. And what this is determining is how satisfied they are with how we pay claims and answer our telephones. So this star rating is a 5-star, up to 5-star rating. And what this is going to let you know is how you will be treated once you are a member of a health plan. So to me, those are the top 3 things that I would say are the most important.
Thank you for sharing that. I just have one more question for you ladies. Now, COVID-19 has impacted just about every area of our lives. How has it changed the way that you are connecting with people right now?
Well, I think just like everyone else, it's the face-to-face contact with people. Ashley and I are so used to doing home visits, conducting our seminars, having our mobile offices at the Parkway, which is our fancy way of saying that we come in and we answer people's questions in the lobby, even enroll you. And so we're not able to do that anymore. But we've adjusted. Everybody's been doing their thing to adjust. And Ashley and I have been doing phone appointments. We're able to do these Skype calls. If people have a computer, we'd be more than happy to set up a virtual meeting. We do some communication by email, and we also can enroll you either by email, over the phone, or paper applications. So people are very happy because even though all this stuff is going on around us, people are still turning 65 and they need their questions answered. They need our help. And we even find that people have decided to retire early and they want to know, well, what does that mean for my healthcare now? And people are being furloughed. So it's more important than ever than Ashley and I be around to be able to put people's mind at ease that there's options.
Thank you.
Oh, can I just say one more thing?
Yeah, of course.
So Ashley, because Ashley can't do her seminars that she so much loves, she's going to let you know what she's doing in lieu of her seminars.
Yes, so we know everybody loves coming to a seminar because you get your basics of Medicare, and then you can also kind of go through the plans with myself. So that's not really an option now, right? Nobody can really attend a live seminar. So what is Excellus doing for that? So what we have actually created is kind of a virtual seminar. So if you're interested in actually viewing one of our seminars, you would go to excellusformedicare.com. Once you're on that homepage, what you're going to do is search for your county, and then the seminar is going to pull up and be presented by the actual Medicare sales representative whose county that is. So you'll go through the seminar. At the end of it, you can always request additional information or material to be mailed to you. And there's also an option to schedule or request a sales representative to reach out to you. So if you have additional questions or you want to schedule that one-on-one appointment over the phone or virtual that Deb had just mentioned, we can always do that as well. So it's just some things that Excellus is trying to do to still make ourselves available to these prospects, these members, these Medicare eligible individuals who still need their help and still need guidance when going through all this information, because it can be very confusing.
That is a great way to give people the information that they need. Hopefully we'll have some people check you out. I want to thank you ladies so much. You have provided a lot of information. And I'm sure people are going to have questions. So Ashley and Debbie can both be reached by email and phone. And I'm going to share those phone numbers and emails with you right on this video as soon as we're done.
Sarah, thank you so much.
Yes,
Thank you, ladies.